Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in Midtown Manhattan, and I'm bringing to you all things health-related for women. Thank you for joining me here at GYN Corner. So let's see, I have another installation on thyroid diseases. Today I'm going to speak, it's actually just a brief chat today. Today I'm going to speak on thyroid storm. We always call it thyroid storm. Some people call it thyroid crisis. But basically, it's a very rare thyroid disorder, which is basically hyperthyroid or overactive thyroid problem on overdrive or on steroids. So it's predominantly a very rare scenario now because most people have an awareness of their thyroid disorder and they get it treated. So it's very rare now. It was more common 100 years ago or so because thyroid disorders were not addressed quickly and the treatment was very poor. But thyroid storm is a life-threatening condition. It's 100% will cause death if left to its own devices, and it's due to basically either someone not knowing that they have hyperthyroidism, so it just persists and gets worse and worse and worse, never gets treated, or someone who is aware that they have a hyperthyroid or overactive thyroid problem and they're not compliant with their medication, they're not taking their medication appropriately, they're not following up, getting their levels checked, so they're just poorly managing their thyroid disorder. Or if someone's just fairly managing the disorder, but there's a stress trigger. So it's a life-threatening condition of extremely overactive thyroid disease. And we all know, or everyone should know based on the previous presentations, that overactive thyroid or hyperthyroid causes increased blood pressure, increased heart rate, temperature rise, so fever, chills, heart beating too fast, blood pressure too high. Those are the core problems. And because of the heart working so hard and the temperatures can be sky high, it will cause organ damage. So you get heart failure, congestive heart failure, you can get liver damage, you can get pancreatic damage, kidney damage. Those are the big ones, and if it persists long enough, you'll get damage to your brain, which is confusion. And the causes are a myriad. If you're not well controlling your thyroid disorder well, the slightest trigger can potentially push it overboard. So I have a list of them. Any kind of trauma, damage or injury, any kind of surgery, even infections, upper respiratory infection or a kidney, urinary tract infection, obviously any bigger issues like someone has a full-on medical disorder, they have a stroke or they have diabetes that goes out of control. So all of those kind of stressors or injuries to the body can disrupt the thyroid balance, and if it's already overactive, it's not being well controlled or managed, it'll push it over to a crisis or a thyroid storm. The symptoms are, like I said, always the same. It's going to be high temperature, high heart rate, high blood pressure, and then the symptoms of the usual anxiety, shaking, agitation, restlessness. Even the bowels they start to lose their bowels, they get diarrhea, loose stools and diarrhea, and then as I mentioned, all of the organs start to fail, so you get liver damage, you get jaundice, you get congestive heart failure. It's called a high output cardiac failure. And then if it gets to the brain, you can get confused, and then it's going to be a loss of consciousness. So it's a big deal. That's why if you or any loved one of yours or anyone you know has a thyroid disorder, hyperthyroidism can become a life-threatening condition. If you see that person is acting strange or exhibits problems like that, you know they're on thyroid medicine, you want to call 911, get them to the hospital immediately. It can be very quickly treated, now modern age, but it does cause death if that person does not seek help. And once they get the mental confusion, they're not going to be in the frame of mind or have the mental capacity where they can seek help on their own. So I hope that's been helpful information on thyroid storm, thyroid crisis. This is Dr. McDaniel. Thank you for watching me at GYN Corner. Please hit the follow, subscribe buttons, and give me a like if you enjoy the information I'm presenting. Please leave comments with future information or future presentations you'd enjoy hearing. Thanks again. Have a great rest of your day. Bye.